Good evening, ladies and gentlemen. My name is Greg Little, superintendent here in Lexington County School District 1, and thank you for joining us tonight for our first Family Together Talk. And tonight we will be discussing some of the changes that we've made since our June 23rd plan about reentering school and answer a number of your questions when it comes to what that reentry is going to look like. Just want to say thank you very much for joining us, number one, and for also submitting questions ahead of time. And if you will notice, you will see in the dialogue box below this video, there's a link that you can submit more questions as we are presenting tonight to our community. So thank you again for being here, and we are glad to spend this time with you. We know your time is incredibly valuable, so we're going to get right into it. And we're going to try to keep tonight right at about an hour. But before we begin, I do want to tell you a quick story. One of my favorite games growing up was playing dodgeball. We always requested it in PE class. It was always so much fun. You know, you're throwing balls at people, knocking people out. They're throwing balls at you, knocking you out. Balls are flying all around, coming from behind you, in front of you. And you're jumping and diving and ducking and doing all this stuff. All at the same time trying to catch it and do all this kind of stuff. We always loved it. Absolutely one of my favorite games. Now, again, bear with me for just a second as I tell you this story, in that the education over the last 6 weeks or so has kind of been like a dodgeball game. Information is flying everywhere. Everybody seems to have an opinion. Should we wear masks? Should we not wear masks? Should we go back to school full time? Should we start virtual? Should we do something else? What does that look like? And as you can imagine, that has been an incredibly difficult context in which to try to prepare and plan for the reentry of schools. But I want you to know that regardless of all that information that's flying around, that our task and our goal is to create a plan that is safe, that is measured, and that is responsible. Because our number one priority is keeping our students safe, keeping their families safe, keeping our staff safe, and keeping their families safe. And so we believe in order to do that, we have to take a measured, responsible, and safe approach to reentry. Now, our June 23rd plan was a really great start. We think it provided a great foundation and has really allowed our thinking to evolve and expand. And over the last 3 weeks, we have certainly seen the numbers in South Carolina increase. We have seen, we've talked to more medical professionals about their opinions about how we should reentry. We've seen the American Academy of Pediatrics and their opinions about reentry and that conversation around mental wellness and those types of issues. And at the same time, we've been gathering feedback. We've been gathering feedback from our teachers. We've been gathering feedback from our parents. And what I would like to share to you tonight is how that feedback and how that learning over the last 3 weeks has shaped some changes to our plan. And that's what I'd like to walk through tonight. So our goal is to come back to school 5 days a week. That's what our goal is. We hope to maximize face-to-face instruction, and we hope that ends up being in a 5-day-a-week model. That's what we propose tonight, is to work towards a 5-day-a-week model. But again, in order to get to that 5-day-a-week model, we have to take measured, safe, and responsible steps. You know, the analogy that I've been using over the last couple days is, one, when you're learning how to swim, you don't just jump in the deep end of the pool. Or when you're learning how to ride a bike, you don't start at the steepest hill in the neighborhood. You work your way up to that to make sure that you're safe and that you can swim and that you can ride your bike. And so for us to get to a 5-day-a-week approach, we can't just jump in and start. So much, everything we will do for next year and so much of what we're learning about next year, everything is going to be new. Every process that we have, every protocol that we have, it will change. Something as easy as a fire drill that we have done forever and that we really take for granted those fire drills because we do them every single month. Even that will look much differently in the fall than it does today. And so because we have to do all these different things, and things we've done forever will also have to be different, we want to make sure that we have the time to transition and learn those things so that we can ultimately go to school 5 days a week. So I'd like to talk with you about our proposal, about how we're going to get there and what our changes to our plan have been. So the first big change to our plan is we're going to ask our board on Tuesday night to move the start date of our school year from August 18th, I believe it was, back to August 31st. Those 2 weeks, again, will give us time to plan. It'll give us time to prepare. It'll give us additional time for the materials that we've ordered to come in and be available to us. But we think that amount of time is going to be absolutely critical to our work. Now, on the back end of our calendar, the reason that we like August 31st is that it doesn't cause complete upheaval on the back end of our calendar versus, say, like the day after Labor Day. If we did something like the day after Labor Day, we really would be pushing the end of our year to starting really past mid-June, which would then cause problems with our summer and things associated with that. So when we looked at the calendar, we said August 31st gives us that time, but then doesn't cause so much upheaval and disruption towards the back end. So that's the first big part of our calendar. First big part of our plan is the calendar change. Now again, the next big part of our plan, what we've learned over the last 3 weeks, is we've really focused on the safety measures that we're going to need in order to come back to school. And we want to maximize face-to-face. And the 3 things that we've taken away, the big 3, number 1 is masks are absolutely vital to the process of keeping our students safe and our staff safe. When we met with a pediatric infectious disease doctor, she told us that she believed in coming back to school, and it was very important for our students. But she said masks have to play a central role in that process. And so we're requiring students in grades 2 through 12 to wear masks in and outside of the classroom. We recognize that students in K through 1 may not be able to keep a mask on their face, so we're strongly encouraging those students to do so, but we are requiring students in grades 2 through 12. We believe that wearing a mask is the number 1 way to control the coronavirus and to protect each other. And it's a sign when we come to school and we're together, we are committing to taking care of our neighbor and to taking care of each other. And in order to do that, we believe you have to wear a mask. Now, you'll notice I'm wearing a mask tonight. And I did this talk yesterday, and I could barely keep the mask on my face, and I end up having to take it off. It is about practicing. We have to get better at using our masks. We have to get better at remembering our masks. Listen, when we required masks here in our central services, I can't tell you the number of times I got out of my car and I'd left my mask inside, or I'd left my mask at home, or what that looks like. So we're going to practice, and we're going to get better at using masks because we know they are so important. Another element that we are going to do is we are going to give breaks during the day to help with mask fatigue. Again, this would have helped me a lot, providing an opportunity to take our mask off, to rest and kind of breathe a little bit, and we'll be able to do that in safe ways. And we'll be practicing that and coming up with those processes and how we are best able to do that. And so you'll be getting more information about what that looks like. Now, the second big thing is about social distancing. And when we're working up to 5 days a week, we want to be able to maximize our social distancing to make sure that space, you'll notice right here, Mary Beth Hill and I we're at least 6 feet apart, and we've tried to be in our masks. We have 6 feet apart. And of course, the third thing is proper hand sanitization. And of course, we have our trusty hand sanitizer here, and we're going to be working with students about how best to wash your hands and to utilize hand sanitizer and soap and water. so that we are making sure our hands are clean. So those are the three big safety things. If you're thinking about it as a triangle, it's mask, it's maximizing social distancing, and it's washing our hands. And when we do those three things, we believe we are maximizing our opportunity for safety and minimizing our opportunity for exposure. Now, the next element of our plan, beyond what we've learned from a safety perspective, I'm just going to drop the rest of my notes right here in front of me. What we've learned from a safety perspective is that we have to ease into this process. So for the first month of school, and this will be another change from our plan on June 23rd, for the first month of school, we are detailing and outlining an hybrid model, an AABB model. And this means that we'll have a cohort of students who will come to school on Monday and Tuesday, a cohort of students who will come to school on Wednesday and Thursday, and then Friday will be an e-learning day for everybody. Now, this is different from the alternating AB days that we suggested early on, and it also includes our elementary school students. So why are we doing it that way? Well, number one, the AABB model was actually suggested by our elementary school folks because it keeps our K2 students with a sense of continuity. You're coming to school on back-to-back days as opposed to a Monday and a Thursday. We also thought Friday as an e-learning day would be easier for our families. So again, Monday, Tuesday, Wednesday, Thursday, and Friday will be an e-learning day. But this is for the transition period only. And we hope that that's just going to be the first month of school, and that's going to be a big difference. And so when that first month comes to a close on September 25th, it's our intention to launch 5 days a week on September 28th. That's what our families have asked for. It's what really when we've talked to our pediatric infectious disease doctors, they've talked about that. We want to be able to maximize that face-to-face learning, but again, we want to be able to do it in a safe, responsible, and measured fashion that will keep our students safe as well as our staff safe. Everybody in the building, we want to be able to take care of, and that's why we believe so strongly in this transition period. This transition period of that first month will also allow us to practice safety protocols. Now, it's our hope that by the end of the first semester, we may see some changes in how we treat the coronavirus, and we might just be able to go right back to normal after Christmas. But just in case that's not, in fact, if that does not happen, what we want to be able to do is we are prepared to go through the whole year this way, and we have to be good, and we have to practice what we do. Again, I talk about the mask that I'm wearing. It takes me a lot to make sure I'm utilizing it correctly. So we want to spend that first month practicing our safety protocols, learning about it in small groups. We also want to look at the impact of quarantining, the impact of what happens when kids have symptoms, how many of our students and staff are testing positive for the coronavirus, what does that look like as a community? All of those things we'll be able to examine very closely during that first month. And then we'll be able to launch, it is our hope to be able to launch full-time face-to-face instruction at the end of September. Now, I recognize, families, we recognize that childcare for that month could be problematic. We have a working group that has initiated a lot of our work with that. They are contacting churches. They are working with our after-school care providers and all those different pieces of the puzzle. And so we are working diligently on childcare. We would ask that if you're a part of a community organization that would like to also partner with us in helping to provide childcare for this first month of school, we would ask that you contact me. My email is glittle@lexington1.net. That's glittle@lexington1.net. Because this is going to be an essential part of what we do. We want to make sure we can help take care of the families who need child care during this time. And once we start 5 days a week, then child care becomes much less of an issue. So those are the major elements of our plan, and those are the elements of our plan that we believe really enhance the work that we're doing. So we spend that first month transitioning and learning all the safety protocols, And then we are able to initiate school 5 days a week if it's safe to do so. And we would be able to watch the patterns of infection, watch the patterns of quarantining, watch the patterns of community spread, and really be able to make a decision, again, that is safe, that is measured, and responsible. That is our goal as we move forward. So that is, in essence, the big pieces of our plan. And we've really worked hard to make this plan be a reality and to be able to transition to get to maximize face-to-face. That's been our big goal. And in order to do that, we recognize we're going to have to transition to make that a reality. So I believe we have some questions that folks submitted tonight. And I want to make sure that we can tackle those as well.
So, Dr. Little, we did get a lot of questions from parents before this video and this talk. So we'd like to share some of those now. And we have a panel that is also recording the questions that are still coming in and adding any of those that we'll come back to those perhaps at the end.
Fantastic.
So according to the South Carolina Department of Health and Environmental Control, Lexington County is currently in the high incidence category for COVID infection. Will these incident rates be used to make final decisions about returning to school face-to-face or going 100% viral?
Well,
virtual, not viral.
Virtual, I got you. I understood what you meant. Well, we will certainly be utilizing those numbers. We're gonna make every decision we make. Certainly, we want to be science-based and data-based. We will utilize our community spread numbers, but we're also going to look at numbers about the numbers of positives for our students and our staff, the numbers of our students and staff who are having to be quarantined, and the numbers of students and staff who are having to be excluded because of possible COVID symptoms. So we're going to look at all of those things as we make decisions before we change service delivery models. That's going to be an absolutely critical element of how we're going to make those plans and how we're going to move forward throughout the year.
So as a follow-up to that question, when you talk about face-to-face or e-learning, is there a possibility we would go in and out of those?
Well, I would tell you there is a possibility for that. So there's a possibility that depending on what happens, so when we go back face-to-face, if all of a sudden we start seeing a spike in numbers or some of our schools become hotspots or how that looks, we may certainly be making decisions about moving back to a hybrid model or maybe eventually to a virtual model as we come in and clean a school if we have a number of incidences in a school. But that's really where the big thing for us is certainly that is a possibility, but we still feel very comfortable as long as we can utilize masks, maximize social distance, and wash our hands, and do that really, really well. We think that's going to build a foundation. And then as we shrink the social distances, our ability to utilize masks and our ability to wash our hands, we think are going to really be able to drive us forward and keep us in a 5-day model. But it's going to take us practicing. It's going to take a lot of energy and effort to get really good at that. And I know when we do, because we will, we have great teachers and wonderful students and incredible staff. When we do, I feel very confident that we'll be able to keep the 5-day-a-week model.
So you mentioned masks, and that is something that many parents asked about. So let me give you about 4 mask questions,
okay,
and then you could just talk about it all at once.
Well, and as you see me, I'm adjusting my mask as we speak, which is a common theme in these thought talks. Absolutely.
Okay, so one of the questions is, will face masks or coverings be required for students and employees?
So let me just talk about that very quickly. So as I mentioned earlier, yes, students and employees will be required to wear masks in grades 2 through 12 and strongly encouraged in K through 1.
Then will the school supply face coverings for students?
We absolutely will. In fact, we're going to be supplying a face covering for every student, and we will be supplying face coverings for all of our staff as well.
Will mask breaks, you talked about those a little bit, be built into the day for students?
Well, they absolutely have to be. A term that I've learned recently is called mask fatigue. And that mask fatigue is when you wear a mask for long periods of time. Certainly as the doctors I've talked to, they've gotten used to wearing the PPE, and it becomes, the longer you do it, the better you get at it. but we are going to provide opportunities during the day for kids to safely take their mask off, to, if they need to just take a break from wearing the mask, we want to make sure they're able to do that. Again, you see me kind of still working on my mask and trying to get good at it. And so being able to take the mask off for a little bit for short periods of time is going to be an essential part of what we do come fall.
So a parent also asked, what if a student doesn't wear a mask, or they take theirs off when they're not supposed to? Will they be disciplined?
Well, I'm sorry, did I jump in?
No, go ahead,
well,
that's good.
We are going to help educate students about masks. And we believe it is our collective responsibility. If we come to school face to face, we have to take care of each other. And if we want to be in school, we're going to have to wear masks to make that happen. Now, ironically, the more we wear masks, the more likely we are to move through that stage faster and actually not need them. So, I believe we need to make sure we're taking care of each other. But when we show up to school, we have to be in this together. We have to look out for each other. Kids have to look out for kids. Adults have to look out for adults. And adults have to look out for kids. And kids have to look out for adults. And that means wearing our mask and collectively saying that we're in this together. We're going to take care of each other.
So you mentioned childcare earlier.
Sure.
And we had parents asking questions about if they're working parents, how are they going to get their children to school at 9 o'clock instead of when they have to be at work? And then later, what do they do about pickup? And so you talked about our partnerships, but if somebody has a question about their child specifically, what do you suggest they do?
Well, we are working, again, we have a working group that is focused on childcare. We realize that childcare before school, if you're having to drop off a student early, childcare after school if you can't pick them up until later, and during the day, especially that first month, childcare could be problematic. And so what we encourage you to do is reach out to your child's school and talk to them about the specifics and your concerns. And again, that's another reason, we're going to talk about this a lot tonight. It's another reason why we need you to fill out the survey and your preference. That will also help us plan for what child care needs will be taking place. So the big thing you can do, the best thing you can do is to reach out to your child's school and talk to them about any specific needs that you have regarding childcare.
And parents also asked, would the after-school programs they're familiar with, like an Alpha Best at a school, would those perhaps still be in place?
Well, we have surveyed our after-school care programs. They have indicated at this point that it appears that they do wish to continue service at schools. And so we'll be talking to them about how best that, how they can utilize that and how they can look after our kids too. So it appears that that is going to be a likelihood to happen.
Right. So of course, as you can imagine, we're getting a lot of questions about the Online Learning Academy.
Sure.
And so if a parent wants to make a change in his or her student's model selection, perhaps they chose face-to-face and now they're thinking about the Online Learning Academy, or perhaps they originally chose the Online Learning Academy and after hearing you, they're thinking about the face-to-face model, what did they do?
Well, first of all, it is super easy to make a change right now. If you want to change your mind after you hear tonight or this weekend, certainly that is something that we can accommodate very easily. So how you do that is I need you to contact Dr. Shane Phillips, and his email address is sphillips@lexington1.net. That's sphillips@lexington1.net. He's your go-to person to make that change. It is not a problem to make that change early. Now, where it gets a little more complicated is the longer we go, the harder it will be to accommodate what you need. So there's always a wiggle room. We want to make sure we're working with our families to ensure that their child is in the right delivery model for their success. The challenge for us is that the longer it goes, the harder it is to identify resources, to identify teachers. So right now, we've had about 16,000 responses to our survey. So we're still waiting on the last 11. So we're beyond the 50% mark. And we're right about, I think the last number was right about 21% of our community who have chosen to be learning virtually and in our online learning academy. So in order to do that, if you think about that number, so say let's the other 11,000 follow the same numbers. Over 27,000 students, 20% represents, I think, if I'm doing my math correctly, about 5,400 students.
About 5,600.
5,600. So I'm not quite, my math is, well, I was an English major. So we're right for 5,600 students. So we've got to identify teachers for those students. We've got to be able to group those students together with grade levels and courses and how we're going to teach those students. So the sooner the better, because the folks we have working on this are working super hard, working long hours to make sure we can do it right and make sure we can do it effectively. So like I said, after July 23rd, I don't know that we'll be able to guarantee or be able to guarantee to accommodate you. Again, we'll do our best, but once that planning really starts in earnest, they've got to nail down the families who are really serious about virtual education. So that's really why when we're asking you to fill out your survey, that's why we need to make that happen, because that survey is going to be absolutely critical for the plans ahead.
So when you talk about the survey, is that information important as far as teachers? Is it important, parents might be interested to know why we need to know that as we're scheduling teachers?
Well, absolutely. So if you have a certain number of students, we will have to then turn around and hire teachers, have teachers apply and hire for those positions and interview and hire for them. We'll have to identify the resources that they'll be utilizing, provide those teachers additional professional development. So there's a lot to do over the next month to make sure that we can really guarantee a high quality, robust, rigorous academic experience on our online learning academy. So that's really our goal. So if you choose to be on our learning academy, I want you to know you're going to be in store for an incredible experience. Your teachers are going to work like crazy to meet your needs. They're going to connect with you and build relationships with you. Now, it's going to look differently, right? It's not going to be the normal face-to-face in the classroom, but I will tell you that those teachers are going to be exceptional Lexington 1 teachers and who will build relationships with the students and really lead those students and guide those students and nurture those students as they develop throughout their classes.
So parents of children who are currently receiving special services are interested in knowing how will those services still be provided for things like speech, physical therapy, if they chose a virtual model, the Online Learning Academy?
Well, I know special education is a hot topic. I know we have lots of people who have questions about special education, about how it's going to be delivered. If you choose the Online Learning Academy, your IEP team will reach out to you to discuss how those services can be provided virtually. Our special education department has learned lots of tricks of the trade since the spring, and they can do teletherapy, among other things. And so absolutely, those types of services can be provided, and those services can be provided virtually and through our Online Learning Academy. But how that will happen is if you choose to say yes to that, then the IEP team will reach out and contact you to discuss how those services are ultimately going to be provided.
So let's switch gears and talk about nurses and nursing services and health services in our schools. So will there be additional nursing staff to help monitor and serve children who get sick at school? And how will the schools be required to, or would they offer COVID-19 testing for students?
Well, those are really great questions about health and safety. We are very fortunate in Lexington 1 where we have nurses at every school, and some schools we have more than one nurse, depending on the size of the school. And they are absolutely incredible professionals who are really going to be the driving force of the work that we do with COVID-19. They're going to be absolutely essential in the work. So while we're not getting more nurses, the nurses really will be focused on ensuring that our schools are doing the right things each and every day with COVID-19. And we are so blessed that school boards in the past that superintendents in the past prioritize school nurses, because there's lots of schools around South Carolina that do not have a full-time school nurse. And we're very thankful that we have access to that. So Amy Wood, who's our director of school nursing, she's going to be working with her team of school nurses to outline their role in our schools. But I'm absolutely excited because our school nurses are the best you'll ever find. And I'm thrilled that they are going to be helping to lead this charge to keep us safe. Now, I believe you had a second question that was about testing. The testing right now, the CDC, I believe, is looking at recommendations regarding nurses and testing students and what that might look like at the school. But it's my understanding right now that no decisions about that have been made. But if we're allowed to be a part of that, I don't want to speak for Ms. Wood, but I'm pretty certain that we would jump in there and really make that a part of our service delivery model.
So as you can imagine, another question parents are curious about is temperature taking.
Oh, yeah.
So are we going to check temperatures before school each day?
So temperature checks, temperature taking has been a hot topic, no pun intended. It's been a hot topic over the last few weeks about whether or not we should take temperatures of our staff, take temperatures of our students, and what that would look like. Based on some conversations we've had with some medical folks, we've decided not to require temperature checks. Now, what we're going to do is our staff, and what we're asking our parents to do as well, is every morning that they do a symptoms check for COVID-19. And so we want to do those self-assessments at home. That's going to be absolutely critical. But in order to take temperatures, it's going to require a huge deployment of manpower and resources and logistics. And when you find out that about 50% of the people are asymptomatic anyway, and that temperature taking really doesn't actually get you what you want to get for what you put into it. Where I'm from, we say the juice isn't worth the squeeze. And so because that's the element around temperature taking, we've decided not to do temperature taking and focus our energy and efforts on educating about self-screening, about mask wearing, proper mask wearing, and hand washing, and maximizing social distances. So that's where we're going to put our energy and effort, and we've decided not to put our energy and effort into temperature taking.
What will be protocols for children who have allergies or they have a ear infection or something that happens during the school day? Some of those symptoms might present like COVID-19. So will they have to get a doctor's note saying that they can come to school, or what will happen?
Well, that is certainly a complicated issue, and we are still working through exactly what that process is going to look like. But I would say right now our intention is we want to make sure that, well, let me give you an example. So lots of COVID symptoms could be a result of lots of things. And like the flu presents that way, if you have strep throat, if you have sinus infection, if you have an upset stomach, lots of those issues can present COVID-19-like symptoms. And so we're still working through what that process is going to look like, and I'm sure that we'll be in close contact with local doctors' offices. Local pediatricians will be working with us about what those issues are, whether it's seasonal allergies, this kind of stuff. And we'll be working with them to make sure that students don't have to miss too much class because of symptoms. But I will say this, the latest understanding that we have from DHEC, though, is if you have symptoms, they really encourage you to stay home about that. But we'll be in contact about how those symptoms interact and about coming to school and not coming to school with symptoms. And we'll be having those conversations as we move forward. And we'll make sure that before you and your child come to school, that is very clearly articulated exactly how we're going to do that.
So thank you. One question too, another category, of course, is quarantine. And so we've gotten several questions about that. I'm going to put some of them together for you.
Okay.
So how will parents be notified of their child's exposure to a positive COVID case? What will this mean for middle and high school students who have many different classes and interactions with other students? And would every student in a class with a positive case be required to quarantine for 14
All right,
days?
so you just hit me with 3 straight questions.
I
So I'm
did.
gonna try. So if I don't get to all 3 of them, be sure to come
I
back
will.
around and ask. So your first question was,
How will parents be
how will
notified?
parents be notified? Okay, so normally what we find, what we expect to happen is that notification will come through DHEC, that we will be working hand in hand with DHEC, but that the notification to parents will come via DHEC. Now, I believe the second part of that question involved middle school and high school.
It did.
So this is one of our greatest challenges, and I need to be really clear about what this looks like in our schools. So for that first month, we're doing this transition period. And so we'll be able to maximize social distances. In most cases, that'll be 6 feet. So DHEC's definition of a close contact is within 6 feet for greater than 15 minutes. So our transition period, we should see very little quarantine numbers because we're maximizing social distances. However, when we go to a 5-day-a-week model, those social distances begin to narrow. And this is one of the things that I think is going to be most challenging with the 5-day-a-week model. So your middle school and high schoolers, they're changing classes, and they're going from classroom to classroom because it's the choice that we offer of educational program that our parents really, really like. But I'm going to use my child as an example. Let's say she's asymptomatic and goes to first period. And we are at 5-day-a-week, so we've minimized social distances. She walks into first period, that clock starts, anybody within 6 feet of her for 15 minutes. Then she goes to second period. Then she goes, eats lunch. Then she goes to third period, and then she goes to fourth period. And she might go to band practice after school, depending on when band happens, or if she had to ride a bus or something like that. In some of our initial calculations, for every student that tests positive for the coronavirus at the high school level, we would anticipate anywhere between 20 and 30 other students that would be required to be quarantined. Now think about like a White Knoll High School that has roughly 2,000 students. So White Knoll, River Bluff, and Lexington all have about 2,000 students. If 1% of those students tested positive for the coronavirus, that would mean we would be quarantining between 400 and 600 some odd kids. Now, that's an estimate. It might be even more than that, depending on where people are sitting in classrooms. So that's going to be one of our greatest challenges. And so that's why, again, we need to make sure that we are wearing our mask and practicing really good hand hygiene. Now, one of the challenges about that is that if we want to make sure we're protecting the stability of the educational environment. So again, let's use my daughter. Let's say this time, instead of her being the one asymptomatic, let's say she is sitting beside somebody who eventually tests positive for the coronavirus. Well, that means she's at home for 14 days. And then she comes back to school and goes to another class period, and maybe she sits near somebody else who's tested positive. Well, then she's home again for 14 days. So that back and forth, we want to make sure, and that's why we're monitoring and measuring those numbers through that first month to make sure that quarantining is going to have a minimal impact on our schools, because that's the thing that I believe is going to be most challenging. Because I would rather have, for Kaylee, I would rather have a well-thought-out blended approach or a well-thought-out online approach that is consistent and well-planned, as opposed to her having to bounce back and forth from face-to-face and then have to go home for 14 days or 21 days, depending on what it looks like. Now, that's the same thing for our faculty. So if the community spread is great, then that could end up hurting our faculty. And if they've been in close contact, they could be quarantined. For example, we've had people here at the office whose children have come home positive with the coronavirus, and because they were in the same household, they were actually quarantined for 21 days or up to 21 days. And that's really difficult to do when you think about substitutes, because it's not just about a substitute. You know, normally our substitutes are a day or two, And most of when we have a long-term sub, that's typically a certified teacher, where there aren't many of those long-term subs available. And so when teachers start being out, and they're out regularly, and you see teacher after teacher after teacher have to be quarantined, well, then what we'll find is we'll find it'll be very difficult to run a school in that fashion. Because again, the central component of our schools are the adults in the building who really create that environment for our students. And so we want to make sure that they are healthy as well. So quarantining is going to be problematic for everybody. And so again, that's right. I know I sound like a broken record, but that's why we want to take our time and we want to be measured and responsible and safe about that transition period, so we can really understand the challenges that are associated with quarantining.
So you mentioned band when you were talking about this. Parents have questions about, do we know yet what chorus or band might look like?
Well, I want you to know, and I want our community to know, that if I don't support the arts, I'm going to be written out of the will. So I need you to know that from the very beginning. My father was a chorus teacher. My brother, my sister, and I were all in chorus. My brother and sister were both drum majors in the band. And my daughter is a senior in the Lexington High School Cat Band. And I know there is nothing that she wants more than to have band her senior year. This is the one thing that we talk a lot about at my house. And I don't know if you have a 17-year-old girl at your house, but I know at my house, this is the thing we talk a lot about. And we want to make sure that we have band and chorus classes. Now, they may look a little differently, but we are planning on having band and chorus classes. And the state organizations with the chorus and band, it is my understanding that they are submitting their recommendations over the next couple weeks. Last I heard, band may be coming out tomorrow. Chorus may be coming out, I think, maybe the 25th, so maybe next Friday. And so we'll take those recommendations and we'll apply them to the working group that's trying to maximize the fine arts. Again, I want to be clear. We do not want to sacrifice the fine arts just because we're in a coronavirus situation. These classes are important. They teach lifelong lessons, and they impact students for much longer than they anticipate. And so we want to make sure that we are taking care of the fine arts and building in systems and building in interventions that allow us to teach them each and every day.
So let's continue with talking about things like band and athletics. A question is, when a parent signs their student up for the Online Learning Academy, would they still be able to participate in things like marching band or athletics?
So the answer to that is absolutely yes. So you're enrolled in Lexington 1, whether you're on the Online Learning Academy or you're face-to-face, you're enrolled in Lexington 1, and you can participate in all those extracurricular activities. Now, some activities, as you know, you have to be enrolled in the class, but that would be normal whether or not you are online or face-to-face. But you are absolutely able to participate in those, whether it be sports or chess club or whatever it may look like. But in order to do something attached to a class, just like normal, you'd have to be enrolled in that class.
And with other activities, you'd probably have to audition or try out.
Correct, absolutely. So, I mean, if you're doing the school play or whatever it is, you have to audition for it, absolutely. But you would still get a chance to participate.
So this might be the biggest category of questions, safety concerns.
Sure.
So how can you ensure my child's safety in the family model when I've seen faculty members not social distancing on social media this summer?
Gotcha. Well, I think, to be honest, it speaks to why we need a transition plan more than anything else. Safety absolutely has to drive what we do. And I know there are conflicting opinions about how safe it is to come back to school and how safe it isn't to come back to school and this kind of stuff. So that's why we want to take our time. We want to ease into it and make sure that it is truly safe for our students and our staff. And that's a great example. Again, our staff, they have to learn how to socially distance appropriately. Our students have to learn how to maximize social distance appropriately. Again, wearing masks, washing our hands, all of those things. We have to practice that to get good at it. That's really essential in our transition plan.
That's great. So here's a question just straight out. would you send your children back to school face-to-face?
So I have 2 children. I have a rising 5th grader and I have a rising senior. And I'll tell you this, I'm 100% confident in our plan because I'm 100% confident in the people in the buildings. I have no doubt whatsoever that those people in the building are going to take care of my children like they were their children. And so my children will be attending face-to-face. We've completed our survey. We've finished our survey. We will be attending face-to-face, and my children will be wearing face coverings like everybody else. And I believe they will be in an incredibly safe environment because we have incredible people, and I know our community is going to help rally around and talk to their kids about the coronavirus and how to protect themselves. And because I really believe this, absolutely my children will be going face-to-face.
Thank you. So if a parent chooses the face-to-face option now, we talked about this a little bit earlier, but they change their mind at some point, or they begin to feel like the risk is too uncomfortable, does that impact their ability to change their minds?
Well, again, it depends on when that happens. The earlier you can make that change, the more likely we are able to accommodate you. But as that goes on to the school year, again, I cannot guarantee that we'll be able to accommodate you because we have already done the resources and everything associated with the virtual or with the online learning academy. But I want to say this, though, about that. We're going to be monitoring those numbers as well. And again, we're going to really be looking at the number of students and staff that are COVID positive. We're going to look at the number of students and staff who are quarantined, the number of students and staff who are going to be exclusions for other symptoms. And because we're looking at those numbers, we'll be able to be flexible about our service delivery model if we need to be. So if we go back full time and we find out that that there's a hot spot in a school or there's a hot spot in our district, we may move back to the hybrid model, or we may take a particular school and move them, say, virtual for, 2 weeks to make sure the buildings are clean and the coronavirus has a chance to kind of run through and move on. So those will be some options for us. But again, if you're asking me right now, I'm pretty confident that we'll be able to maintain a 5-day-a-week model if we do all the right stuff with the mask and if we do all the right stuff with our hand sanitization.
That's great. So parents are asking, what can they do to help in reentry? Is there something that they need to purchase? Is there a service they could provide?
Well, right now, I would say just hold tight on that stuff. As we get closer to the beginning of school, we will certainly communicate with you. Really, the most important thing you can do for us right now, the most important thing you can do for us is to talk to your students about wearing a mask, practice it, have them practice it. Talk to them about the importance of social distancing, especially early on. Talk to them about the importance of washing their hands. Show them how to wash their hands. Talk to them about utilizing hand sanitizer or using soap and water, what that looks like. The more they know, the better prepared they will be to take care of their classmates and to take care of each other. Again, this is going to be a collective effort. You see my mask falling down again? This is going to take a collective effort of us looking out for each other and getting better at utilizing masks and doing all that work. But it's absolutely within our power to do so.
And this is probably a year that we're not going to ask. Teachers are not going to ask them to bring 6 pencils that go into a collective bin.
Right. So more than likely, and again, we're going to be fleshing this out, but more than likely, your child is going to have to keep their school supplies, and we will do very little sharing. And the teachers will be working on how the best ways to do that will be do very little sharing. So, again, if you want to buy some supplies for some children you think might be of need, we can certainly talk about that. But we'll give you more information as we get closer to the school year.
So it's going to become important that they remember to bring that pencil to school.
Absolutely. It'd be very important to make that happen.
So that's our last question for right now.
Do we have any questions from the group?
We do have a few questions from the group. I think one big one is, for folks who maybe joined us after we had started, or who just need to see this one more time, will there be a place people can go to see a summary of what you're talking about tonight?
Absolutely. So our Stronger Together website is going to be up and have all that information. We're going to be putting that information out after Tuesday night's board meeting. Maybe even before. There's going to be some changes with a frequently asked question. We will absolutely have that plan available. We'll be able to outline it for you. We'll be doing, Mary Gaskins and Dr. Smith will be presenting that plan again Tuesday night to the board. So we have plenty of opportunities to take a look at that. If you're a glutton for punishment, you could hit rewind and watch this presentation again if you'd like to do that. But really, we're putting lots of questions on our Stronger Together website. Take a look at those, examine those, and certainly we're going to be talking about this plan some more on Tuesday.
Thank you. We have several questions around transportation. Do we
Sure.
know how early our buses are going to start running? Will we be able to maintain that social distancing? What will that look like?
Well, those are great questions. So again, I'm going to sound like a broken record, but that's a big reason why we need you to complete your survey. And that's a big reason because we can begin to know what the bus routes are going to look like, when those bus routes are going to need to start. Right now, DHEC's recommendations are that buses have 50% capacity. Again, we'll be asking students to wear masks on the buses. That's going to be something, again, that's going to be very important, and to try to maintain social distances as well on those buses. But it's going to be about a 50% capacity according to DHEC's regulations and recommendations. And so when buses start, when bus routes start, are really about when we know how many students have chosen the virtual model versus how many students have chosen the face-to-face model.
I know you've spoken a few times about how parents can make some changes if they've decided to move from the online academy to face-to-face. But just to clarify, regardless of what's happening with our face-to-face model, the online learning academy will be in place consistently at least until the end of first semester, and then we'll talk about what that means moving forward.
Absolutely. So that's a great clarification. Thank you, Ms. Freeman. So when you choose the online learning academy, you need to assume that it's going to last through the first semester, and then we will reevaluate at that time. Again, the issue is when you're trying to bring together, if 21% or whatever the number ends up being, choose that academy, it's going to take a significant amount of time, energy, effort, and person power to make that a reality. And when you're talking about 5,000 students, that's bigger than lots of school districts in South Carolina, and just being on our online learning academy. So we want to revisit that at the end of the first semester, because listen, we hope things have changed, and by second semester we can be back to normal, and we can be through with all this stuff. But understand, we have to prepare and plan in the event that it isn't. So we're hoping for the best, but we're going to make sure we plan for the worst, because we want to make sure our students and staff are safe.
When we think about those AABB scheduled days, will we be able to cohort siblings together on those days?
Absolutely. We will be cohorting siblings. We know that can be a challenge if you have older siblings and younger siblings, and the older siblings actually can look after the younger siblings. We will be giving preferential treatment to families or children within the same family, and other types of the issues associated with that. And we'll be working, you'll be getting more information about that later, but we absolutely will be making sure that family groups are together.
Had the question, could they not be together? So you have some families who say they might rather their children be on an AABB.
Well, again, sometimes I know when you think about Thanksgiving and Christmas, you don't like to be around your family. If that's not a need you have as a family, we will not utilize that for you as well. So you can have, if you have siblings, that will be a choice you can go either way with.
And if I have some questions about that as a parent, should I contact my school, someone here at Central Services? What would that look like?
Yeah, so the best place to go, and I'll tell everybody, the best place to go for information is contact your school. They will be able to provide you with the most up-to-date information that is specific to your needs, because your schools, they know you the best. And so they'll be able to provide you with all the information you need, and if they don't have it in the moment, they'll be able to get it for you and then get back to you.
And you may have mentioned this earlier, I'm sorry if I missed it, but will I be able to wear a mask of my choosing as a student, or will I need to wear the district-provided one?
Oh, that is a great question. I don't know that I covered that earlier. So we are certainly providing masks, but we believe that students are going to end up wanting to wear masks that they think are most comfortable for them. I know, I'll tell you what, I have a daughter who's very sensitive, has a lot of face sensitivity. We're going to have to find her a different kind of mask probably. You see me, I'm wearing a different kind of mask tonight than I was wearing a surgical mask last night. I've been trying and playing around with some different versions of masks. I would also imagine there's a Gamecock fan out there that wants to wear some garnet and black, or there may be another school that might be, say, purple and orange. They probably want to represent as well. I know my children like to wear the Tar Heels, the Carolina blue mask. So yeah, so absolutely, we honestly expect our students to wear their own mask if they so choose. But we also didn't want to make them do that. We wanted to give them an option about that. So we have our own masks that we will be providing them.
Do we anticipate having students and staff test for COVID-19 before they return?
At the moment, we do not, but that is certainly a conversation that I believe that we can have. But right now, what happens is if you test people before they come back, we don't have there's a lag time for when you test them. So you can test them, and then if 6 or 7 days pass before you get results, that test becomes much less predictable because they could walk out of the place and within 24 hours or something and probably get it as well. So that's not necessarily been on the top of our priority list, but I know other school districts are having that conversation, and it's a conversation we're going to at least explore.
But as a general, not as a general rule, but as a rule, we would not test any child without the parents'
Oh, no
permission to
doubt
do
about
so.
it. Let me say that right now. We are not testing any child without parent permission. We would never do that. We would never conduct a medical procedure with your child without having a conversation.
Anything else? We do, Dr. Little, we have quite a few questions. I know we won't be able to get to all of them tonight, but we do have quite a few parents who have sent messages in to say that they do feel like the safety of their children is being considered, and they appreciate that and wanted to express that. And so I think that was important for you to hear tonight. We certainly have questions about specific programs, whether that's immersion or gifted and talented, all of those sorts of special ed coming in. So 4K, I didn't know if you wanted to talk about how that information might be coming.
I do. That's a great question. So if you have a specific program that you're involved with, you listed them, 4K or immersion or special ed or gifted and talented, the people who are in charge of those programs will be contacting you specifically with information. So the reason we didn't address that tonight is because there's a process that will be in place where people are reaching out to you and helping you provide that information that you're going to need. And they're going to be doing that sooner rather than later. Are we getting close? You got one more? We maybe take one more, or is that about it? I know we're getting close to our time.
One that's come up that we haven't, and this will be our last one, when it comes to our cleaning protocols, do we have a plan for cleaning and specifically a plan to make sure that the chemicals we're using are safe for our students?
Yeah, so that's been really a large part of our planning over the last probably 6 to 8 weeks. We've been ordering approved materials that are safe for our students, that won't have them break out into rashes and those kinds of things, because we are going to be doing cleaning, high-touch surfaces. We're going to be cleaning, light switches and doorknobs and these types of things. So there's going to be, our cleaning protocols will be in place to try to keep us safe. And we're going to be, we're ordering lots of equipment now to make that efficient and effective. And yeah, so all those chemicals will be kid-friendly by utilizing them because they're going to be doing it throughout the day, as well as on school buses. All right, thank you very much. So again, as we come to the end of this hour, I want to say thank you again for joining us on our first Family Together talk to discuss our reentry plan. I so much appreciate all that you do. I want to leave you with 2 thoughts tonight, and then we'll be done. Number one, Practice, 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 practice. That helps us more than anything else. If we work with our students and have them prepared to walk into school on day one and be ready to know what mask and social distancing and hand washing best practices around that. That's the first thing. I also need you to do me another favor. And this is not really about reentry. This is about the wonderful people in our buildings. I got a lot of feedback yesterday from a lot of people in our buildings who felt very despondent and their morale was really low after yesterday's press conference. They really felt like they had been beaten up a little bit. And so what I'd like for you to do is I'd like for you over the next 24 to 48 hours, find someone who works for Lexington 1. Be a bus driver, a cafeteria worker, a speech pathologist, a teacher, an instructional assistant, a principal, a chief communications officer, whatever it might be. And the list goes on, and I certainly don't want to leave anybody out. But I want you to know that they need to hear and be, I tell you what, let's be positive. Let's lift them up, and let's tell them how much we appreciate their efforts, because, folks, Lexington 1 is great because we have great people who work in our schools and who work for our schools. They give their time, they give their effort, they're dedicated, they're passionate, because they want to go above and beyond for kids each and every day. And so what I would like for us to do is to be positive and lift them up. You know, my wife tells me she sees some things on social media, some negative comments about our teachers and about the people in our building. And I just want to say that really breaks my heart, because I know how much they love your children, and I know how much they give to your children. So let's be positive. Let's lift them up. Let's tell them how much we appreciate them and how much we are thankful for them. Because without them, there is no greatness in Lexington 1 schools. People are moving here from across the country because of the educational environment that they provide. And so I think it's important to remember that we're going to do this together, that it's going to take all of us pulling together as a team, collaborating with one another, collectively looking out for each other. That's how we're going to be successful in the fall, because it's going to be new for everybody. I promise you, it's going to be a great challenge. There is a big hill in front of us, but we can climb it. We can be successful. We don't have to just survive. We can thrive when we work together and when we take care of each other. Again, I just want to say thank you so much for joining us tonight on our first Together Talk, and know that we will be doing more of these as we discuss reentry. And this plan, or this video rather, will still be available on the YouTube channel. And thank you again for all that you do.
We would ask you to do one more thing for us. If you look in the description of the video, you'll see a short survey, a little evaluation. We'd like you to give us some feedback about this first talk with parents, because we plan some of these in the future. We want to make sure that we're doing what you want us to do, what we hope it met your needs. So if you give us that kind of feedback, that'd be great too. Thank you.